Hello, everyone. Welcome to our briefing. This briefing is presented by WorldAware. WorldAware provides intelligence-driven integrated risk management solutions that enable organizations to operate globally with confidence. Our speaker today is Jonathon Keymer. Jonathon is a senior intelligence manager at WorldAware, analyzing threats across Europe and Russia. He has worked in the travel security sector for more than a decade and has a master's degree in WMD proliferation and international security from King's College London and a BSc in economics. Jonathon is going to provide an update on the COVID-19 recovery in Europe. Jonathon?
Thanks, Mary. Many of you will be familiar by now with the scenario model we've created to show how the pandemic's likely to develop in specific countries in the next 60 to 90 days. But the general characteristics of each of our four possible scenarios are as shown. So health first, the governments would maintain widespread restrictions, but crucially would retain public support. Incremental normalization, the government would roll back restrictions without endangering public health or causing public anger. And again, the public would therefore remain largely positive. Business first would be if the government rolls back health restrictions, but this has a negative public health impact and consequently would generate negative public sentiment. And no normalization would be significant restrictions remain in place, but the public's not on board, with widespread dissatisfaction perhaps manifesting as disobedience to government restrictions, growing political opposition and civil unrest. Health first and no normalization are the restrictive scenarios, and incremental normalization and business first are the de-restricted ones. And the major determinant is whether public sentiment is going to be positive or negative. Negative public opinion, of course, or sentiment, of course, has a direct impact on security, commercial, and health activities for a business in a country. Public sentiment could also have a bearing on criminality, civil unrest, and in some areas even terrorism. If the public feels at risk due to perceived lack of health and safety measures at work, for example, they could remain at home, which would impact employers, and they could even go on strike. If they're non-compliant with regulations, they will exacerbate the challenges of containing the disease. So public sentiment is crucial. So to determine a scenario, we monitor around 150 location-specific indicators around things such as demographics, availability of medical equipment, medical capacity, levels of anti-government feeling, economic data, announcements from stakeholders, be they government, opposition, unions, charities, health workers, foreign governments, etc. We benchmark all of these indicators against four drivers, and the key drivers are government action and public sentiment. Government action, i.e. whether they're going to be restrictive or de-restrictive, and medical capacity and the effectiveness of businesses' response both have a bearing on how the government will act and also have a bearing on how on board the public will be. So our first case study is Italy, where we predict incremental normalization is likely in the next 60 to 90 days. And the likelihoods of each scenario is as shown with the percentages. The figures in brackets, the second figures, they're the likelihoods of each scenario when we assess them at the beginning of June. So you can see the change gives you an idea as to the country's trajectory. And the major changes here are that following concrete and visible lifting of restrictions in recent weeks, the chances of the de-restrictive scenarios, so incremental normalization and business first taken together, the chances of those being realized has gone up. But there's also been a slight deterioration in public sentiment. And decreasing public sentiment is probably going to apply across most locations of interest. Public sentiment is a finite resource. The more protracted restrictions are, the longer economic uncertainties persist, the more likely negative feeling is to increase. So as time goes on, the chances of negative scenarios, and in this case specifically business first, are likely to increase. Now, the eventual success of the Italian government in responding to the initial outbreak earlier in the year and its enhanced preparedness now will enable it to deal with a further rise in cases. The government has felt confident enough to reopen the economy in a gradual way, and it's maintained public support. Authorities have allowed most businesses to reopen, provided that they follow strict health and social distancing requirements and regulations. Public transportation, including airlines, trains, buses, continue to operate, but with reduced frequency at the moment and less demand. The European Union recommends that Schengen-associated countries, of which Italy is one, and we're talking essentially of EU and EEA member states, commonly known as EU+. The EU recommends that they relax entry restrictions for non-residents and has maintained a list or maintains a list of approved countries, including Australia, New Zealand, Canada, Japan, from which European Union and EU plus members are advised to de-restrict. But actual authority as to whether outsiders are allowed into a country is retained at national level. And Italy has opted to maintain restrictions on non-Schengen area associated countries for the time being, which just does show that the government is slightly more cautious than the regional norm, which isn't surprising after their experiences earlier in the year. The government has approved a €55 billion stimulus package, which also shows that it's working on ways to keep the economy going while providing a social safety net for those who cannot work yet. And this puts the government in a better position to not feel too much public pressure to rush in lifting the restrictions. And the restrictions is therefore likely to be carried out in a way that minimises the potential for a significant widespread escalation in cases. However, Italy was already in a recession at the start of the pandemic, and the government is likely to be keen to reopen the economy without undue delay. And some observers have criticised the government for being too hasty in lifting restrictions. And if the government is seen as being too hasty lifting restrictions, this will more likely, if the indicators shows that, will be more likely to point the country towards a business first scenario. This would be particularly more likely in the summer tourist season. Obviously, Italy is I wouldn't say it's dependent on tourism. It's an industrialized country, but tourism is a big part of its economy. So this coupled with sort of the concrete government moves toward de-restriction is reflected in this increase in the chances of business first from 5% to 10% here. The government's previously demonstrated its willingness to impose massive movement and business restrictions, and it could do so again if the phased relaxation of measures is followed by a significant escalation in daily infections. The government could suspend further relaxations of measures, and it could possibly introduce some localised or nationwide measures without prompting a significant public backlash. A health first scenario is therefore feasible, although it's less likely than we saw at the beginning of June. And public sentiment in Italy is going to likely remain positive if any maintenance or reintroduction of restrictions occurs at local level, targeting individual local COVID-19 outbreaks. And we think no normalisation is therefore pretty unlikely at the moment. So what we're looking at going forward with Italy is the principal indicators are those that might influence government decisions around the pace of de-restriction. So we're talking about case numbers relative to medical capacity, negative economic data, and the scope of any multinational stimulus packages. These will likely influence whether the country will reopen its borders up according to the EU recommendations. Other indicators such as opinion polls, incidents of civil unrest, protests over the government COVID policy, and disagreements within the coalition government will also be important in assessing the public mood and likely pressures on the administration to maintain or ease restrictions. A word of warning though, and this is an illustration why all of these indicators have to be looked at in their own national context. When you're looking at public sentiment in Italy and you start seeing sort of widespread transport strikes, this might be mistaken for negative public sentiment, but widespread transport strikes are a reversion to the norm in Italy, and they might actually be a better sign that the public is beginning to sort of feel more comfortable. And so widespread industrial action in Italy could itself be an indicator of a return to normality. Our second case study is the UK, which we also assess is moving toward incremental normalisation, but again, decreasing public patience is increasing the chances of business first scenario. The rate of infection has slowed significantly. The medical services currently have significant excess capacity to deal with case numbers, and hospitals are resuming routine procedures. Emergency surge facilities such as the Nightingale hospitals have been deactivated and placed on standby, ready for an increase in cases should they follow the de-restriction. Widespread case testing is being made available to people with symptoms, and the government has hastened the relaxation of restrictive measures. Most restrictions on businesses now have in fact been eased. Nevertheless, infection rates are higher in some localities and have prompted the government to prolong and reimpose measures in the city of Leicester, for example. And this is part of a general trend we're seeing toward dealing with the pandemic as a series of local outbreaks requiring targeted responses rather than one national outbreak, which would need a blanket indiscriminate mass restrictions. So there's currently also discussion around whether to impose a similar Leicester-style lockdown in the town of Blackburn, in Lancashire, northwest England, and we'd expect to see more of these in the coming months. The government currently requires international arrivals from most countries to undergo self-isolation for 14 days, and this, along with widespread testing, is going to better enable the UK to lift domestic restrictions and concentrate on tracking individual domestic outbreaks. And we can see examples of how this will work. As well as Leicester, we've got 200 workers on a farm in Worcestershire who are currently self-isolating. The Health Secretary at the end of last week said that there are around 100 such incidents and sort of very micro self-isolation regimes being introduced, 100 per week, to deal with individual outbreaks. That's where it's going in the UK. The option to offer bespoke reactions to these individual outbreaks is going to facilitate the relaxation of blanket restrictions, so it dampens the chances of these restrictive scenarios of health first and no normalisation. But any large-scale reintroduction of restrictions would also not be popular, which is in fact reflected in the increased chance of no normalisation here. So no normalisation would be widespread restrictions and negative public reaction. Now, although the vast majority of the public is broadly complying with the restrictive regime, there are increasing signs that the public sentiment is fraying. The UK has seen several protests and counter-protests around the Black Lives Matter movement, for example, as well as illegal street parties, beach gatherings and things that have contravened social distancing requirements. The pubs have opened in England as well. I expect to see quite a lot more of this kind of sort of disregard of social distancing going forward. On the flip side of the coin, though, with the public opinion, no general election is expected before 2024. The government is still retaining a lot of public support. Recent public opinion polls say they're still 3 points higher in the polls than they were when they won the election in December. So the government has got no immediate political requirement to respond to public opinion at the moment. But regardless, the public support for government's de-restrictive policy is high, and the government is unlikely to reimpose nationwide restrictions, also due to economic concerns as well as that likely public frustration. Although the authorities' furlough scheme, they've extended that until October, but they're asking employers to contribute to that from August. And this indicates the government's not prepared to, support companies indefinitely. It reinforces the sense that they need to de-restrict and reopen the economy. The economy contracted by 20.4% in April. The government really needs to get things moving. So the UK could still enter business first if the relaxation of measures is premature and is followed by a significant spike in case rates. Also in the UK, there's lack of effective case tracing ability, which is going to complicate the efforts of the health authorities to respond to individual outbreaks and increases the chances that local outbreaks will spread exponentially before they're actually picked up. So with the UK, the main indicators we're monitoring include those which inform us about the government's ability to effectively target those individual domestic outbreaks, excuse me, without the need to reimpose nationwide restrictions. So reliability and availability of case data is just as important as the trajectory of case numbers, and such data will become increasingly reliable as mass testing is carried out. However, while testing is going to assist in that early detection of outbreaks, lack of effective tracing is going to continue to impede the ability to track and isolate cases. And therefore, we're going to be examining reports around the development of the government's tracing regime in the coming months. We'll also be monitoring the effectiveness and duration of any localised lockdowns, not just Leicester, which is due to end on Saturday, but also what's going to happen in Blackburn. They might reintroduce another lockdown there in the next few days. Reports, leaks, public discussions in the lead up to the government's next COVID-19 review, which is due on July the 23rd, they'll be important in judging whether the authorities are continuing to lean toward de-restriction, particularly regarding the reopening of schools in September. Indicators are that the government's moving towards the indicators that the government is moving toward maintaining or introducing mass restrictions could include measures to mitigate longer term economic damage, support for businesses to enable flexible working, and cancellation of public events later in the year. Regarding public sentiment, we could still see dissatisfaction manifesting as growing disobedience to residual restrictions. While it's unlikely to include large-scale protests against the government's COVID policy, we might see people flouting restrictions, gathering socially, and ignoring social distancing requirements, which could themselves prompt the government to move toward more mandatory rather than advisory restrictions, which would indicate a move toward a further wider lockdown, particularly if there was a commensurate rise in case numbers. And finally, we're going to be looking for high-profile pessimistic surveys from businesses regarding long-term economic recovery, and that would they would add pressure on the government to de-restrict and at the same time generate public anxiety over job security and so on. So our next case study is Germany, where we assess it's increasingly likely to achieve incremental normalization better than any other country in Western Europe at the moment. In the last month or so, as national and state governments have eased most restrictions, we've clearly seen a move away from the restrictive health first to the de-restricted incremental normalization. The crucial factor is the German government has done this while maintaining broad public support. And if we're reading the indicators correctly, this kind of movement, with the figures increasingly honing in on the dominant scenario, is what we'd expect to see more and more of as time goes by. And Germany is quite an easy one due to its relatively low case numbers and what appears to have so far been a very effective government response, despite a certain amount of scaremongering from some quarters on the ground. Now, as with the UK, we've seen a move away from indiscriminate blanket restrictions towards targeted restrictions. So we've seen the districts of Warendorf and Gütersloh in Nordrhein-Westfalen. They've been locked down following an outbreak associated, or they were locked down following an outbreak associated with a meat packing factory, and both lockdowns have now eased. Even more targeted, we've seen hyper-granular lockdowns of residential blocks in Göttingen and Berlin's Neukölln district. And we've also seen the self-isolation of a church congregation in northwest Germany. We've seen some negative reactions from to these local lockdowns. We've seen sort of violent unrest by affected residents in Göttingen, for example, which reinforces the point I made earlier that public patience is not inexhaustible. However, the general trend in Germany is towards de-restriction. The government's unlikely to feel a need to reimpose mass restrictions at this stage. They've got a sound medical infrastructure at their hands. The authorities are confident in their ability to manage a resurgence. They're more confident, for example, in Italy in reopening international travellers from non-EU plus countries, and they've broadly done this in line with the EU's recommendation on international travel. Also, Germany's in technical recession, which is going to continue to motivate the government to maintain this de-restrictive momentum. The use of these targeted measures, like in Gütersloh and Warendorf and elsewhere, suggests the health authorities are confident that they can isolate local outbreaks, which removes the necessity of these indiscriminate blanket nationwide restrictions. In Germany, widespread testing and effective tracing measures relative to its current caseload means that the government's very well informed with case data. So with the lifting of restrictions, it's unlikely to be premature and based on inaccurate data at this stage. And that means business first is pretty unlikely. But when this Thuringia lifted state restrictions at the end of May, this did generate a lot of vocal public concern. So it does suggest that some negative sentiment is inevitable following the easing of measures, restrictive measures in the short term. So for Germany, the key indicators that we'll look at would include announcements from national and state authorities concerning the dismantle of residual restrictions and a move away from mandatory rules to advisory guidance. And these would further reinforce that trend toward incremental normalisation, as would any lifting of residual entry restrictions to international travellers from beyond the EU plus area, for example, including the US. Rising case data would suggest a national resurgence in cases which might necessitate restrictions above the local level. If the government continued with de-restrictions in these circumstances, that would indicate a trend towards business first. And in addition, any rising public sentiment against the government's policy could also suggest an increased likelihood of business first. While normal protests, so you're talking demonstrations by anti-capitalists, environmentalists, anti-immigration groups, these are likely to resume and become more frequent in the coming weeks. That would be a return to normality. But if they escalate in frequency and intensity to a level greater than that we were seeing pre-pandemic, then it could be an indicator of negative public sentiment. So we'll be looking for those. Our final case study is France, where the current outlook is very similar to the UK at this stage. It's likely to achieve incremental normalisation, though for different reasons. The country is maintaining its de-restrictive momentum. Its state of health emergency expired last Friday, and all departments in metropolitan France are now designated green zones, which is the green zone is the best of the three-tier system France uses to judge the local health threat. The national medical infrastructure has been sufficient to manage the COVID caseload, and the daily infection rate has fallen significantly from its peak. And again, they've complied largely with the EU recommendation and are permitting entry to travellers from approved non-EU plus countries. However, while the public is generally on board with the government's approach, there have been signs that this support is beginning to wane, which is reflected in the shift away from incremental normalisation and health first. Underlying labour unrest and other social frictions could quickly return. Remember the yellow vests last year, for example, and perhaps this could exacerbate anti-government feeling if the official COVID-19 policy is judged to have been inadequate. We've seen several protests in recent weeks in defiance of government restrictions. Demonstrations will likely increase in scale as restrictions on gatherings are relaxed. There are powerful labour unions in France, and they're able to mobilise widespread industrial action and large-scale protests should businesses be seen as not as failing to safeguard their workforce, for example, by failing to provide appropriate PPE, social distancing, ability, etc., in the workplace. The unions could also mobilise industrial action and protests if the government and industry are widely perceived to be prioritising economic needs over the health of workers. Now, due to economic pressures, again, and the likelihood of increased public disobedience to restrictions and the potential for a civil unrest should measures be reimposed, the government's likely to seek to avoid large-scale reintroductions on a national level, reintroductions of restrictions, I should say, on a national level. But if the government continued to relax restrictions or failed to reintroduce restrictions in defiance of public concerns, that would probably lead more towards a business first scenario. Now, authorities have begun a trial of mass testing in Paris and the Ile-de-France region to detect dormant case clusters, which, if successful, they're planning to replicate in other areas, and that would enable authorities to accurately reimpose targeted restrictions at local level, as we've seen in Germany, the UK and elsewhere. And this increased testing will facilitate the government's task in lifting the sort of nationwide restrictions. But as far as case tracing is concerned, as opposed to case testing, the public engagement with the official contact tracing app in France has been a lot lower than anticipated, and that means that the government's local de-restrictive measures could sometimes be based on incomplete data, which again is reflected in that increase in the chances of business first. Any growing signs of public dissatisfaction would suggest that any attempt to reimpose widespread restrictions would be unpopular and would likely lead to a no normalisation scenario. The retention of public support during any second lockdown is therefore unlikely. So we're not going to see a health first scenario, or it's very unlikely we're going to see health first with a positive reaction to the reimposition of widespread restrictions. So as elsewhere, the key is the pace of government de-restriction. And so we're looking at the indicators that the government will be looking at. So case numbers, rate of infection, if these are deemed to be accelerating, it's more likely the government is going to be to reimpose restrictions, for example. But we still think this is more likely to take place at local level as the data becomes more reliable and more available. So medical data emerging from that expanding test and tracing regime will therefore also be a key indicator. And we'll be monitoring for any government announcements around the implementation of any local lockdowns, and we'll be looking at whether these local lockdowns are likely to be followed, because we've seen a lot of disregard of social distancing in some parts of France. So are these local lockdowns going to be followed? Is it possible to enforce them, for example? We'll be looking at public and business sentiment towards any new local lockdowns. Now, while the government has so far shown a willingness to prioritise combating the pandemic over the economy, negative economic developments are going to act as a disinfectant for any reintroduction of restrictions. So we'll be looking out for those. And we'll also be looking at statements and policy positions from political parties and from the large labour unions, particularly those in the health sector. We've seen some health sector related protests in recent days. They also indicate the state of public opinion and will help determine whether it'll be an incremental normalisation or a business first scenario. We'll also be monitoring the scale, frequency and intensity of any legal or illegal gatherings to ascertain public support for the government. But as I said, and as with Italy, the resumption of mass protests is partly a return to normality in France. So I'll just sum up by giving a general outlook for Western Europe. There is a clear trend toward de-restriction, and it's likely that any reintroduction of mandatory restrictions will be limited and targeted based on locality or based on demographics, so age or health, or by occupation. Such measures could apply to individual districts or neighbourhoods, or even be hyper-granular, targeting specific facilities like churches, farms, factories, accommodation and office blocks, and so on, as we've seen in Germany and the UK. Wider blanket measures will likely be increasingly advisory rather than mandatory, and rely on the sense of the public and the sort of the civic spirit of the public, which can, believe it or not, work in some areas, but it's less likely in others. But that's not to say that nationwide measures are unthinkable. In Central Asia, we've seen blanket restrictions, travel restrictions reimposed in Kazakhstan. We've seen them reimposed in Uzbekistan. In most Western European countries, it's a slightly different situation. There is better case data. There is greater spare medical capacity. There's collegiate cross-border cooperation. And all of this means it's easier to keep the bulk of the population unfettered and able to operate, while at the same time isolating those vulnerable sections of society. But public sentiment is not inexhaustible. If massive restrictions are once again necessary, they won't be as easy to impose a second time round. The public's going to be less willing to buy it, and negative public sentiment won't just manifest as riots. It could be mass disobedience to regulations, employee absenteeism, fear of turning up to work, for example, due to the COVID threat, industrial action. So we could actually be looking at business and transport disruptions, even in the absence of official restrictions.